I want to thank you all for joining us today. Today we're going to make two sets of announcements that have one continuing goal, and that's to improve healthcare services in the Northern Health Authority and in the interior and the north of British Columbia, and indeed on Vancouver Island, with respect to emergency health services. So we're going to make both. We're going to talk about both announcements today. The first is about the Northern Health Authority and addresses the challenges, the ongoing challenges of recruitment and retention of healthcare workers in the North. I want to acknowledge the work that's gone into this, particularly from the Northern Health Authority. It's part of a broader announcement we'll be making in the fall for a broader human resources plan for healthcare going into the future. But these are actions, interim actions that are taking place this year to help support and address issues in the North. I want to acknowledge the many people who have contributed to this at the Northern Health Authority, first of all, but also my MLA colleagues, Nathan Cullen and Jennifer Rice, who have contributed significantly to this in raising issues and pointing to concerns, and my colleagues, the Leader of the Opposition, Shirley Bond, and other colleagues in the North, such as Dan Davies from Fort St. John, who have also contributed to this, as well as mayors, such as Mayor Ackerman and others in the North who have contributed to this. They've raised these issues, we've talked about the importance of them, and today we're taking action that reflects our collective efforts to make things better for people in Northern BC. Today we're announcing $6.38 million for programs to retain and recruit more healthcare workers in the Northern Health Authorities by making the North a desirable and accessible place for health professionals to live and work. To address this, actions are being taken at every level in Northern Health, starting immediately with the launch of a comprehensive healthcare worker rural retention program that is targeted towards priority communities and occupations. The program is designed to offer financial incentives and support for healthcare workers and will be funded directly by the Ministry of Health. It won't come out of the Northern Health budget at approximately $3 million. Further, funding of $821,000 from the Ministry will be put in place to continue the Travel Resource Program, TRP, and keep the more than 40 registered nurses and nice practical nurses who receive support from that program. We're also offering a flexible community fund of $115,000, again from the Ministry, that supports patient care delivery to support interdisciplinary teams and the Health Authority to work together and create a unique approach to address rural obstetrics needs and support 24/7 care for their communities, and help, in particular, stabilize care in the Northwest at Mills Memorial Hospital. The Ministry is providing $225,000 in funding to develop a child care program to support expanded net new child care spots and expanded hours of operation to meet the needs of healthcare workers often working, as we know, 12-hour shifts. Anticipated regions for this include Kitimat, Hazelton, Prince Rupert, Chetwynd, Dawson Creek, and Fort St. John. The Ministry is providing $750,000 to develop a housing program in communities where suitable market housing is a barrier to permanent staffing and short-term deployments. Regions include the Robson Valley, Kitimat, Hazelton, Prince Rupert, Chetwynd, Dawson Creek, and Fort St. John. We're launching the Rural Urgent Doctor and Aid 24/7 virtual support pathway for physicians and other healthcare professionals in rural communities with $825,000 in funding. And funding of up to $645,000 by the Ministry is also geared towards creating clinical management supports for Prince Rupert and the Northeast that increases clinical program management capacity to support new graduates, provide more resources for management competency development, increase number and distribution of managers, and improve management support systems. These measures come together, I think, at an important time in healthcare across the Northern Health Authority. We have, as you know, at the moment, very significant challenges. Really, at this moment, for example, with COVID-19, we have the highest level of COVID-19 per share of the population in Northern Health of any region in BC. And there are challenges nonetheless, challenges that are structural and fundamental, and ones that we have to continue and get at and address now. I want to thank my colleagues in the legislature for being part of this. I want to thank everyone at the Northern Health Authority and their team. And in a little while, you'll hear from the chair of the board of Northern Health, Colleen Nice, who will speak more about these issues. The second set of issues I want to talk about today is BC Emergency Health Services. And I want to express, first of all, my appreciation to our Interim Chief Ambulance Officer, Leanne Heppel, who's here with me today, a really extraordinary board chair, Jim Chu, for all of the efforts they have made since we laid out our action plan in July to address issues at BC EHS. They have worked very closely with QP Local 873, but also met ambulance paramedics and people in different parts of the province. It has been great to have Leanne and Jim playing this role, and Jim and Leanne are both exceptional leaders, so we're very proud of their efforts. People will know that in June, but really throughout the period, there was all of the issues around June 28th and the days subsequent to that, but also really in this part of the pandemic, starting in June, when we saw a very significant rise in ambulance calls across our system in BC. Those calls tested our province's emergency resources. In BC, our goal has been to have and is to have the best ambulance system in the world, delivering the best possible service. That's why since 2017, we've increased the BC Emergency Health Services annual budget from $424.25 million to $559.12 million. We have doubled the average annual spending increases compared to previous years. This has meant more paramedics, more dispatchers, and more ambulance on the road. And all of that is critically important. It is, in fact, the most significant single area of increase in healthcare other than mental health and addictions we've had since 2017. Between 2017 and 2019, we added 115 paramedic positions to support direct patient care, improve service and response time, and modernize dispatch operations. In the first half of 2021, 271 new permanent paramedic positions were added and hired into BC Emergency Health Services. Nevertheless, the heat wave showed us that there was more work to be done. And since then, our government has made progress on a number of measures that I announced in mid-July to restore and strengthen emergency health services. One of the key aspects of that, and while there's a lot of focus and is a lot of focus of our efforts and Heppel's efforts and Jim Pugh's efforts on Metro Vancouver and on urban areas, Metro Kelowna, urban areas in general, one of the key areas, one of the most important areas for communities is ensuring ambulance service throughout this enormous province and providing that service. So I'm pleased to announce today, consistent with what we talked about before, but expanded beyond this, that 24 ambulance stations in rural and remote communities will be converted from on-call paramedic staffing to 24/7 Alpha stations. This is 2 more stations than what we looked at when we first talked about this in July. Communities benefiting from the enhanced ambulance service are Lake Cowichan, Port McNeill, Tofino, Cumberland, Bowser, Pemberton, Ashcroft, Barrier, Caramios, Lillooet, Princeton, Sicamous, Clearwater, Revelstoke, Peachland, Fernie, Golden, Kimberley, Burns Lake, Fort St. James, Houston, Vanderhoof, Chetwynd, and Fort Nelson. This means we'll have an enhanced ambulance system and a more stable paramedic workforce in rural and remote communities that can more quickly respond to emergencies. What this also means is better paying, predictable, full-time jobs for our paramedics, which will in effect improve and in fact improve our retention and retainment of the workforce. As well, 26 smaller stations that have moved to or will move to schedule on-call staffing model are getting more permanent regular paramedic jobs starting on November 1st. Communities that will see this enhanced service are Alert Bay, Atlan, Bear Lake, Blue River, Cortez Island, Dease Lake, Edgewood, Elkford, Field, Goldbridge, Grand Isle, Greenwood, Hudson's Hope, New Denver, Port Alice, Port Clements, Riondell, Sayward, Seton Portage, Swantula, Southside, Stewart, Tassus, Texada Island, Wells, and Sabalos. Hiring is also underway for the new 85 new full-time paramedics and 30 new full-time dispatch staff announced in July. They will be in place in October and November. Under the guidance of our new interim chief ambulance officer and our new board chair, BCEHS has been working hard to roll out important changes to its staffing model across the province to improve services to patients, and stabilize paramedic staffing, especially in rural and remote communities. When you need an ambulance, that service is the most important government service provided. And our commitment is not just to Vancouver, although it is to Vancouver, not just to Surrey, though it is to Surrey, not just to Abbotsford, though it is to Abbotsford and Kelowna and Kamloops and other urban communities, but to everyone in the province. And these announcements today and this effort reflects that. I want to say that further to this, that our new interim chief ambulance officer has been working with paramedics and dispatch leaders to ensure BCEHS is fully prepared for the continuing higher demand we are seeing across the ambulance system. This includes being more flexible in staffing and resource adjustments as needed, increasing clinical support in BCEHS dispatch centres to help triage and manage calls, 24/7 manager support in dispatch to help with delays and escalation, introducing new low acuity patient transport units for Metro Vancouver and the Fraser Valley to transport less urgent patients and ensure ambulances are available for high acuity patient response, and working with health authorities, especially in busier hospitals, to reduce ambulance turnaround times to help get paramedics back on the road. I am so appreciative to the work that Leanne and Jim have done over this summer and now as we approach the fall. You may recall in my introduction of Leanne, and I'm going to introduce her third in the order, that she's a trained clinical nurse specialist. That prior to becoming the interim chief ambulance officer, she was our Providence Healthcare's chief operating officer, acute care, and chief of professional practice and nursing. She has some serious healthcare game. I think that's the summary. And it's great to have her, and I want to thank her and Jim for all their work. So significant improvements to address recruitment and retention issues in Northern Health. Significant plan announced and being implemented to improve ambulance service in every part of BC. This reflects what communities have asked of us. It reflects the effort that's been made to bring the BC Ambulance Service, BCEHS, into the 21st century. And that work has been going on for some time, and I'm very proud of that work now.